Hello. I come here with a lesson to do with care in pediatrics. The components that we're going to look at is A, immediate care of the newborn. We're going to do B, subsequent care of the newborn. And then we'll look at the emergency care in pediatrics. So these are the elements or the components that we are going to discuss to do with care in pediatrics. All right. So to begin the lesson, when you talk about immediate care of the newborn, we are necessarily looking at the period from the time the head is expelled up to the time the baby is fully expelled from the mother. So when you're looking at immediate care, we are looking at the period of time from which the head is delivered up to the time the body of the new infant is fully expelled from the mother. So this is the parameter in which we are looking at so that we know the kind of care that we can give to this child or to this infant. Okay, so now in looking at the immediate care of the newborn, I've come up with elements that we can use when we are caring for this infant or for this neonate. What are those elements that we need to look at? So the first one is identity and bonding. The second one is initiation, establishing, and maintenance of vitals or establishing vitals. Okay? Then the next part is the umbilical cord cutting. The cutting of the umbilical cord is one of those elements within the immediate care of the newborn. Then observation. Under observation mainly is giving the appropriate score of the baby using the Abacus score. Okay? Under observation, we give the baby the appropriate Abacus scoring. Then hypothermia prevention. Apart from that, then we have hypoglycemia prevention. Then we have position and psychological care. I'm not saying you have to restrict yourself to this, but I'm saying these are very important elements that you can look at when you are caring for a child that is within the immediate care of the newborn. These elements are very important. If at all you want to remember them in an easier way, you can remember the vowel sounds of A, E, I, O, U, okay? And we have prevention, we have psychological care and position, that is for PP. And we have hypoglycemia prevention and hypothermia prevention for letter H and the other letter H. Okay? So that is just an easy way of remembering the immediate care of the newborn. Let us add more details to this. When we are looking at identity, we have to identify the time the baby is born. This is very important so that we give the child their birthday and time. So the time and date the child is born. But I'm thinking by the time the mother is coming, you would have already recorded the dates. But the time here is very important, the time the baby is born. Okay, apart from that, there should be identification of the sex of the baby. Okay, when the baby is born, you need to show the mother the sex of the baby and you need to show the baby to the mother. So there is identification of sex of the baby. Alright, so that is found in identity. But deliberately, I also added bonding to it. Bonding is very important. When the baby is born, you have to show the baby to the mother. Due to the contrast difference of the environment of the uterus and that outside environment, the baby, when it is born, it opens its eyes. Okay, and when you show it to the mother can now identify their baby as they are seeing it. There's that psychological bonding that happens. It's that there's a psychological relief that the mother now see that their baby is alive and they have seen their baby. Okay, so bonding. To do with identity, the mother, when they see the baby, when you show them the baby after the baby is born, okay, they will identify the baby. And that enhances the bonding. Okay, so that's why the issue of bonding came a little bit separate to do with the identification of the infant. So that is one of the elements under the immediate care of the newborn identity, where you have to identify the time the baby is born, the sex, but also it is important that you need to note that you also have to put the name band. The name band should not be too loose, or else it may come out and you may lose the identity of the baby. And also it should not be too tight, it may affect circulation. So the name band will have the name of the mother, okay, the sex of the baby, and other details according to your hospital policy. Then we move on to establishing vitals. So in establishing vitals, we are necessarily looking at initiating, establishing, and maintaining respiration. A good nursing care should have aims. So one of the aims of immediate care of the newborn is to identify the baby by putting a name band. Okay? Is to initiate, establish, and maintain respiration. Is to appropriately score the baby according to the Abigail score. Okay, so those can be some of your aims of immediate care of the newborn. But we are looking at establishing vitals, or initiating, establishing, and maintaining the vitals. Here, the emphasis is on respiration. So, when the baby is born, the baby will cry. So, a loud, husky cry, it shows that the baby is okay. A loud and husky cry, it shows that the baby is okay. When you're talking about premature baby, a high-pitched cry, it may be a sign of hypoglycemia or increased intracranial pressure. So just from these cries, you are able to tell certain things objectively according to science. A hoarse voice may be a sign, of laryngeal stridor. A poor cry, we see it in premature babies. So premature babies, they have a poor cry. So initiating, establishing, and maintaining respiration goes further as wiping secretions. When you're wiping secretions from the nose and the mouth, it can initiate breathing. It can help initiate breathing, and can also prevent the baby from choking. So you first wipe the mouth, or you can suction from the mouth, then you suction from the nose. For the simple reason that if you start suctioning from the nose, the mucus within the mouth can choke the baby. So you suction first the mouth, then you suction the nose. Okay, the other way of initiating and establishing or maintaining respiration is by giving a massage on the sole of the feet. That can help to initiate breathing. So you can massage the sole of the foot of the baby. Okay, you may have other interventions of establishing this, but we are saying when the baby is born, immediately the baby is born, the baby needs to cry. Okay, so that other physiological changes may be put in place. Okay, then we have the aspects or elements of umbilical cord. The aspect of umbilical cord here, we are saying cutting the cord. So if you have to cut the cord, you have to put a gauze in between, that is 8 centimeters to 10 centimeters away from the umbilical stump. You have to clamp with a forceps and put a gauze in between, and also clamp on the other end that is connected to the placenta. And it is at the middle where you cut. The purpose of putting the gauze is to prevent blood from contaminating the birth area, to prevent blood from spatting so that it may mess up the birth area. So we put a gauze. But after that, there is an umbilical peg that you can put away from the umbilical stump, that is 3 to 4 centimeters. You can clamp it and then remove the forceps. Okay, then you can also cut the other part. So that is what we do with umbilical cord. Okay, of course, in the immediate care, we also need to observe the umbilical cord to see if all the blood vessels are there. Okay, because absence of one of the blood vessels may be a sign of other abnormalities. So we can check the umbilical cord if it has all the blood vessels to rule out abnormalities. Okay, then we move on to observation. When talking about observation here in the immediate care of the newborn, it's mostly to do with the Apgar score. We have talked about this in our aims, that we need to appropriately score the baby according to the Apgar score. The Apgar score has got scoring from 0 to 10. 7 to 10, that is good, but no asphyxia. When you talk about 4 to 6, there is moderate asphyxia. And then when you talk about 0 to 3, there is severe asphyxia. The baby has problems with breathing. 0 to 3. Any score below 7, you have to notify the doctor. It calls for some. So now, so to do with hypoglycemia, when the baby is born, within the first 1 hour, you have to encourage the mother to breastfeed, especially if there is no problem with respiration. So this is to prevent hypoglycemia, especially in preterm babies. When we talk of term babies, there are brown fats that they can still use for insulation against the cold, and also for them to get the glucose that they need within the first 2 to 3 days. That is for term babies. But for preterm babies, they are prone to going into hypoglycemia. Alright, so we have talked about hypothermia and how you can prevent it, okay, through those processes like convection, conduction, where the baby can lose, so that you know the interventions. And then hypoglycemia, we are encouraging the mother to breastfeed within the first hour after the baby is born. There is also another benefit to this, is also to encourage the proliferation of normal flora within the GIT, because when the baby is born, the intestines are sterile and there is no manufacturing of vitamin K. So the baby is prone to having bleeding that may not stop, because the normal flora there that's supposed to manufacture vitamin K, which is needed for clotting, is not there. But otherwise, you find that in other settings, the baby is also given a vitamin K injection. Okay, so encouraging the mother to breastfeed also allows for proliferation of normal flora within the GIT, yes, so that vitamin K can be manufactured. All right, but our main concern here is preventing hypoglycemia. Okay, then we look at position. The baby can be positioned in Trendelenburg big position, where the head is a little bit lower and the whole body is a little bit you slide the body a little bit upwards. This is to ensure there's good drainage. Okay, but otherwise, if there's contraindication, there's what they call side lining. sidelining of the baby with the head tilted to the side encourages secretion. Of course, there should be a pillow, okay, that should prevent the baby from turning the head so that it does not look down. When it looks down, breathing can be affected, and then you're going to have what we call sudden infant death syndrome, which mostly comes because of poor positioning of an infant. So, what we're saying, position is very, very important here to encourage drainage. Okay, to encourage drainage, position is very important. So Trendelenburg's back, where the head is a little bit lower and the whole part of the body is a little bit tilted up. If it's contraindicated due to increased intracranial pressure and other things, you can do the sidelining. Sidelining with this pillow on the side to prevent the head from tilting so that there is adequate drainage of secretions. Then psychological care. Under psychological care to do with immediate care of the newborn, we are necessarily talking about bonding. Okay, when the baby is born, immediately as you show it to the mother, put it on the mother's abdomen. It also helps to transfer some heat from the mother to the baby, though there is that minimal exchange, but that encourages bonding between the mother and the baby. So you have to put the baby on the mother's abdomen. So psychological care is very important so that you encourage family relation or bonding interaction between the mother and the baby. Okay, so there might be not so much emphasis on hypoglycemia prevention in the immediate care of the newborn, but what we are saying is that especially for preterm, this is very, very important, especially very, very important. So this is what we can discuss under the immediate care of the newborn. In a nutshell, that is what we can look at. Okay, so now let's look at the subsequent care, okay, of the newborn. Subsequent care of the newborn. Under subsequent care of the newborn, we are necessarily looking at hypothermia prevention, hypoglycemia prevention, breastfeeding of the baby, infection and injury prevention, psychological care or bonding. We're also looking at physical examination of the child, that is head to toe, and also checking of reflexes. That is necessarily what we are looking at. And adding more details to this hypothermia, we have talked about this one when we are talking about immediate care of the newborn. Hypoglycemia, we have talked about this one when we are talking about the care, so the interventions are the same. Infection and injury prevention, here we are necessarily looking at hand hygiene. People that are attending to the baby, there should be adequate hand hygiene. The attendants to the baby, they should be free from infection, especially respiratory tract infection. There should be practicing of rooming in by the mother, where the mother is allowed to be with the baby most of the time. There should be adequate dusting of the room so that the baby does not catch infection. They are prone to this. There should be barrier nursing because the baby has lower immunity. There should be eye care. Okay, in other institutions you find that there is also putting of tetracycline eye ointment in the eyes for the baby to prevent as prophylaxis. Okay, apart from that, also teach the mother about cold care. Cold care is very important, how to observe the cold for infections and other things, and also avoiding using herbal products on the umbilicus. Apart from that, the diaper should not cover the umbilicus. You need to tell the mother within 7 to 10 days the umbilical cord will fall on its own. If it is not drying in the light, she can always come to the hospital. Okay? So that is to do with infection and injury prevention, where we're talking about hand hygiene, attendance free of infection, rooming in, well-dusted room, barrier nursing, eye care, and cold care. Psychological care, here it's encouraging bonding the family to be around. But remember, if it is a preterm baby, there will be restrictions. Who sees the patient, and there will be procedure as to to how they can see the patients, the things that they are supposed to wear. Okay, then physical examination. On physical examination, you necessarily look at head to toe and look at the things that are normal within the baby as you are examining head to toe, and also look at the reflex in the physical examination. All right, so now, in a nutshell, when you're looking at subsequent care, here the mnemonic is just B and P to the power 5. So B is breastfeeding, and then P is for psychological care, physical examination, okay, and then we look at the hypoglycemia like BPH, okay, BPH, that is benign prostate hypertrophy, mostly that we refer to. So BPH is we're looking at subsequent care. We're looking at the breastfeeding, psychological care, okay, the position, those things that you need to teach the mother, okay, hypoglycemia, hypothermia prevention, okay. In all these, immediate care and psychological care, IEC, information, education, and communication is very, very important. It's very important, even in the immediate care. Information, education, and communication is very important because the mother needs to be educated on how to care for the baby. All right. So now that takes us to another aspect to look at, which is C, emergency care. Emergency care in pediatrics. So emergency care mostly surrounds under ABC, and we can never run from airway, breathing, circulation. Because if we have problem with airway, we may lose the child. We have problem with breathing, we may lose the child. We have problem with circulation, we may lose the child early. So all emergency care, we need to look at, when you look at emergency, you need to look at things that may be affecting airway, things that are affecting the breathing, and things that are affecting circulation. If these things acutely affect respiration, then we are definitely looking at an emergency. Okay, what are the elements that we are looking in emergency care? So here it's more like A, B, C, D, E, F, G, H, I. Then I've put N, P, O as part of the elements here that we have to look at. So which elements are we looking at necessarily? A is for airway. Airway, suctioning of the baby, wiping of the nostrils. Okay? Breathing, you have to observe that the baby has normal breaths of about 30 to 60 breaths per minute. Then the circulation, you have to observe the baby's pulse, but it is not less than 100 or it's not above 160. Because if it is above that, it calls for intervention. Then D, drugs. Emergency drugs that can be given. Okay, for hypoglycemia, here we talk about those drugs. If it is bleeding, vitamin K, we talk about those emergency drugs. But when you're looking at first aid, it's more like dispose of, take to the hospital. But here, the child is already in the hospital. So we are looking at what emergency drug can we give depending on the emergency that is at hand. Okay, then E is environment. So the environment should not make the baby prone to hypothermia. So you have to prevent hypothermia. That is to do with the environment. So that is to do with E. Okay, then we have F, fluids. What affects circulation in the ABC? We have to, if it's an emergency that's affecting circulation, we have to put fluids. Fluids are very important in order to stabilize electrolytes within the body. So we talk about F, fluids. Then G, is gown, clothes. Put the baby in dry clothes. No, I said the crying of the baby is a sign that the baby communicates to us. Okay, if the pants are wet, the baby will communicate by crying. So gowns ensure that you put the baby in nice warm clothing. We were talking about G for gown or clothes that you give to the baby. Okay, so we're saying baby should be in clothes that are warm. Okay, of course, covered in the face. Okay, but there should be room for proper breathing. So the clothes should not be too tight so that it does not affect circulation. And okay, that is to do with G clothes. So there's a way baby communicates to us, okay, when the pants are wet. So that has been mentioned. Okay, then we look at hypoglycemia. For hypoglycemia and environment, we have talked about prevention of hypothermia. So that is for hypothermia and environment. Now, how does hypoglycemia come in? If there are low glucose level, less energy will be produced, less heat will be produced. So we have to ensure that the baby is fed so that they have necessary glucose reserve to produce the energy and the heat that they need. So you can find ways of incorporating your nursing activities and the environment to prevent hypothermia and also preventing hypoglycemia. Okay, because the issue of preventing hypoglycemia by giving feed to the baby also helps to keep the baby warm. The milk that is coming from the mother has a bit of warmth that is transferred to the baby. Okay, so in that sense, so kind of light, that is what you need to look at. Then I is for emergency investigations that can be done. Okay, in every emergency there are some special investigations that can be done. Okay, you can do blood grouping, you can do blood cross match to see if at all there is something that you have to do here, research compatibility and the likes. You can do it for the emergency care of an infant. And I've put NPO, that is N for nutrition, preventing hypoglycemia, that is coming there. Important of feeding the baby if it's cup feeding and the like. So all that you need to teach the mother, okay, about cup feeding and the likes if the baby cannot feed from the breast. So that is very, very important. Okay, so P, psychological care. Okay, P for position to prevent sudden infant death syndrome. Okay, P for prevention of infection because these are prone to infections. Then O is observations. Here, observations in the emergency care will only be general and depending on the type of that emergency which has come. So when you're talking about emergency care in the child, so it's also very important to identify which one of the conditions that you are attending to is an emergency. Okay, and the part that is affecting, is it the airway? If it acutely affects the airway, breathing or circulation, any of these, it is an emergency. So you need to establish which one of these does this condition acutely affect, so that you establish which one is an emergency. Because a lot of students face challenges in establishing which one is an emergency. So if you should not face that problem from today onwards, you have to see that condition suddenly and acutely affects airway, breathing and circulation, then that will constitute an emergency. Okay, you can have other ways of trying to classify emergency, say an emergency, but in an emergency it should acutely and suddenly affect these: airway, breathing and circulation. Other things that you can still look at depends necessarily on the condition, because even too much pain can constitute an emergency. Okay, there are conditions where patient will come in acute pain, and when you're talking of conditions like mental health, of course I've discussed the nursing care in mental health. Okay, you may look at a violent patient and constitute that as an emergency because you need to restrain the patient. Okay, but for pediatrics, which is our discussion today, we are saying you have to look at airway, breathing, circulation, and if the patient has acute pain and the likes, then that will constitute an emergency. Now, let me give a little bit of a summary of what we have just been talking about today. We have been looking at the care in pediatrics. Under the care in pediatrics, we have established that there is immediate care of the newborn from the time the head is delivered up to the time the baby is fully expelled. That is immediate care. Subsequent care is the care that follows immediate care. And then we have emergency care. Those are the elements that we are looking at. Now, to fully understand on how we can nurse babies in these stages, we have come up with elements that we can look at. So the element includes identity, establishing, respiration, umbilical cord cutting, observations, and mostly that to do with the Apgar score, hypothermia prevention, hypoglycemia prevention, position, and psychological care. And I've said these elements, you can still add other elements, but I feel they stand at the core of your nursing care in the immediate care. You can still add more. All right, apart from that, then we have looked at the subsequent care. So subsequent care, here we are looking in the immediate care, we said R, A, E, O, U, and then we have P, P, H, and the other letter H, so that you remember the core elements there. In here, to do with the subsequent care, we have letter B, letter P, and H to help you remember. So these, even if I call them like when you're writing the short form of a certain disease called benign prostate hypertrophy, okay, you write as BPH, okay? So you can try to remember from that. Not that I'm saying that is the disease here. No, you can try to remember from that angle because you are familiar with that. So here we are saying we are looking at breastfeeding. You have to follow the steps of breastfeeding. You have to teach the mother on how to breastfeed, how to properly position the baby when you are breastfeeding. All these things are very, very important to ensure that the baby is well fed. But apart from that, in the subsequent care, we are looking at hypothermia prevention, the change of environmental temperature of the uterus, which is about at 7.7 according to the mother temperature, and the environment of the delivery room, which is about 21 to 24 degrees. This rapid difference may cause the baby to lose a lot of heat. Then hypoglycemia prevention. Hypoglycemia prevention here, we are saying you have to ensure that you breastfeed the baby and give the appropriate medication. Infection prevention and injury prevention, this one is very important. And under this, we are looking at hand hygiene, attendance, not to have respiratory diseases or diseases that can be transmitted to the baby. You have to practice rooming in. There should be proper dusting. Okay, so now this one is HARD, that is the element under infection prevention and injury prevention. Then apart from that, barrier nursing should be practiced because they have lower immunity. Then eye care, giving of prophylaxis, and cold care to avoid infection. Then apart from that, psychological care, it has to do with bonding, and physical examination, it has to do with you knowing the proper parameters of head to toe. In normal head circumference, okay, up to the toe examination, what abnormalities can you detect? Apart from that, you check for the reflexes. Okay, so the nursing care, you have said, is born from a prophenemum, that is aim, position, rest, observation, psychological care, hygiene, environment, nutrition, exercises, medicine, and advice that you can give. So nursing care does not mean we have to write all these elements in each and every nursing care. No, we refine it according to the condition all the time. So that is why when you're talking about emergency care, I've used letter A up to letter I, and then I've put NPO in discussing the emergency care. In my using of these words, I've talked about airway, breathing, circulation, drugs, emergency drugs that you can give, environment, necessarily to emphasize on prevention of hypothermia, air for fluids, emergencies that are affecting circulation, then gown, to talk about clothing that you need to provide to this. No baby is born with clothes, so you have to clothe the baby. encourage prevention of hypothermia and hypoglycemia. High emergency investigation that are supposed to be done. Then I've put NPO for nutrition, position, prevention of infection, psychological care, and then O for observation. So in a nutshell, that is what we can discuss to do with the care in pediatrics. Other conditions, you just follow their prophenema. Okay, prophenema, you can care for pediatrics using that. But I felt this, which we have discussed today, is specific to immediate care, subsequent care, and emergency care. The other elements from a prophenema, you can and look specifically at the condition, looking at the signs and symptoms that are in that condition for you to come up with a nursing care. Of course, that is what I felt should help you in caring for patients in pediatrics. So thank you very much, please, for listening. Ensure you also watch other videos that we have recorded on nursing care to do with the mental health, to do with integrated reproductive health. You just have to watch those, then comprehensively you understand on how to nurse these patients that we have discussed. So thank you, please, and stay blessed.